Hello dear friends. Today I will discuss the surgery for bow legs. Bow legs refer to our legs, whether male or female. This issue is common among women, where the gap between closed legs looks like a bow. These problems are really easy to solve. They are issues that can be resolved comfortably, and we often hear this feedback from our patients. So, why have we waited so long for a solution, doctor? What can we promise or suggest for the bow legs problem? Firstly, the most common solution we use is silicone implants that will correct the bowing. Expect this to take half an hour. You won't even need to stay in the hospital. You'll be able to walk in heels 3 hours after surgery. You'll need a minimum of 5 days and a maximum of 10 days to be able to walk flat on the ground. You can return to work comfortably within 4 to 5 days. Some of my patients even return to work the next day, but I usually mention that 4 to 5 days are necessary. If the deformity isn't too noticeable, there's another option for bow legs. I suggest fat injections for those patients. Of course, for the fat injection option, we need a certain amount of fat to correct the bowing. Naturally, the area from which we take the fat must have fat. For instance, if you have a problem with your hips. When we take fat from that area and inject it into your legs, you will both get rid of your bow legs problem. And if you have hip issues, your hips will look smoother. You'll accomplish two things at once. This procedure is short, similar to silicone implant surgery. It lasts about an hour and you can go home the same day. You will need to wear a corset for 3 weeks because of the areas from which we take fat. We anticipate that half of the injected fat will dissolve. The remaining half will continue to live as viable cells for a lifetime. So fat injection treatment is a permanent solution option. Don't think of this as a quick fix. The fat will disappear when I exercise or defend myself. The other half will be your own tissue and will remain for life. Therefore, since we anticipate that half will dissolve, we aim to inject a bit more than necessary to ensure the remaining fat is sufficient. To summarize, we choose either silicone implants or fat injections for bow leg surgery. In specific cases, we combine both options to help you overcome this issue and ensure your happiness.